Hi students, welcome to Case Studies in Healthcare Administration. We are in Unit 6, and this presentation is going to focus on Case Study 47, How to Negotiate with Healthcare Plans. So let's talk about how to negotiate with different healthcare plans. So first, readiness is everything. It's important to know the market in your area and the strengths of your own practice within the market. So if your group has not yet engaged in strategic planning, it's important to do that first. So the data gathered for your strategic plan or SWOT analysis includes an assessment of the strengths, weaknesses, opportunities, and threats of your practice. This offers a critical underpinning for effective negotiation with payers. So in analyzing internal strengths and weaknesses, you want to include hard data such as the number of new consults and cost of drugs per physician. You also want to maintain data about the utilization, revenue, and expense of your practice. So systematically and regularly, you should also be surveying patient satisfaction and gather information from the hospital administrators and referring physicians about the performance of your practice. It's important to document the benchmark aspects of your quality and efficiency. Another thing to remember for readiness is rank your referring physicians by frequency and type of referrals. You also want to maintain data on the insurance plans in which they participate. So before meeting with a representative of a healthcare plan, you should find out from your frequent referrers how significant that plan is in their practices. In addition, you need to know your market share. The next element is monitoring your contracts. So most health plan contracts are evergreen and will automatically renew unless one party proposes a modification. It's important to know when your contract expires and how much notice you must give to make changes. So as the date approaches, analyze the contract and determine whether any changes are needed. Also within your practice, you want to channel on all contract with a healthcare plan through only one person. It's also good to remember that physicians in your practice should be cautioned against signing any paperwork they receive addressing rates, charges, reimbursement, or network participation. Some healthcare plans can come across as just having deceptive practices to entice physicians to sign a brief form confirming their membership in a preferred provider network. So the document may be worded to seem like just another form to be signed, but in some cases, such a signed document can represent a contractual relationship. So you want to establish a simple rule that any document not related to a specific episode of care for an established patient should immediately be forwarded to the administrator in your practice who is in charge of the contracts. The next element that we have is determining your position. So in preparation for contract negotiations, you want to set a bargaining range that includes an optimum, minimum, and target goal. So the optimum is your starting point. Example, the terms you consider ideal. The minimum is a point that must be met for you to sign, and the target is the point at which you would like to end up after negotiation. So you want to go into negotiations knowing what alternatives you have. This includes your BATNA, which is your best alternative to a negotiated agreement. Next, we have negotiating the contract. So physicians often think the terms offered in a contract are immutable, and the plan representatives may say that they do not negotiate with physicians. However, you have to remember that everything is negotiable. Another negotiating principle is to understand the goals of the other party. So you want to make sure that you know the issue about which the payer is concerned and make sure you address them during contract negotiations. Finally, you should be prepared to share your practice data with payers when these data can substantiate compliance with clinical pathways or demonstrate restraint in the use of expensive or unnecessary services. Doing so, this is going to make it easier for the payers for their data if they claim that competing providers are more efficient or have lower costs. And then finally, fees are not the only items to negotiate. So reimbursement is the most significant area of a contract. Procedural requirements can be erroneous and even deal breakers. So it's important that you look at all contractual elements, and these areas of practice include authorization process for treatment, period specified for submitting claims, a period allowed to appeal a denied claim, requirements regarding use of oral or injectable drugs, time specified for timely payment and interest paid for a late payment, process for adding new service lines or adding new physicians to the plan, period required for providing notice of modification proposals, and a cancellation clause. So it's important to keep in mind that all portions of a contract are negotiable.